The ancient Egyptian excelled in many fields, the most famous of which is architecture, which is clearly evident around us in temples, such as Luxor Temple, Karnak Temple, and Hatshepsut Temple. There is also sculpture and engraving, which we see clearly in tombs of two values of kings and queens, specifically in the tomb of King Seti I and the tomb of Queen Nefertari of 19th dynasty. One of these fields is medicine. The ancient Egyptian divided medical workers into two categories, doctors and medical assistants. As for the doctors, there were many of them, and therefore they had different specialties, including the Dr. Haysira, the oldest Egyptian physician we know. Haysira dates back to the 3rd dynasty. When you go to the Egyptian Museum in Tahrir, you can see several wooden panels found in his tomb. These panels are engraved with the titles of Haysira, including Chief Physician and Chief Dentist. This last title is evidence of the different specialties. Also among the doctors is Dr. Bistrit, the oldest and first Egyptian female doctor, as a stone block dating back to the Old Kingdom was found bearing many of Bistrit's titles, including the title of Supervisor of Doctor. Of course, the supervisor must be aware of the tasks and work of those that supervises. Unfortunately, that mural is located in the Vienna Museum of Fine Arts. When we talk about the detection process, it took place in 3 basic stages. The first stage, dialogue and discussion with the patient to find out his feeling and the pain he feels. The second stage is comparing and likening symptoms and feelings with other symptoms and feelings in order to make it easier to clarify the problem. Third stage, palpation is done through the fingertips of hand on wound to determine its depth or on the fracture to determine its position and size. The ancient Egyptians learned medicine in special medical schools, which were attached to temples and holy places. These schools were called Bir Ankh, meaning the house of life. In them, the person received medicine and some religions related to medicine. Enrollment in these schools had some conditions, including that medicine be passed down through the line, and that there be a wealthy person in the family, so that he could afford the tools used. The most famous of these schools is the School of Medicine in Sao, currently Sal Hagar in Gharbiya Governorate, Medical School in Own, currently Ain Shams in Cairo Governorate, Medical School in Abydos, currently in Sohag Governorate. Regarding diseases and fields of medicine, they were diverse and different. Among them, childbirth, which took place in 2 stages. In the first stage, the woman was sitting on her knees and facing forward slightly. When analyzing this position, it was found that it was the position in which the groin was most relaxed. In the second stage, when the pain of childbirth intensifies, the woman begins to step back until she is in squatting position, and there are 2 women next to her to help her give birth. This method was followed until recently in the Egyptian countryside and Upper Egypt. In order for the ancient Egyptian to know the gender of the fetus, they sprayed the mother's urine daily on both barley and wheat. If the barley grows first, the fetus is female, and if the opposite happens and the wheat grows first, the fetus is male. Diseases also including bone diseases. Specifically, we will talk about the case of shoulder dislocation. In order for the doctor to restore the dislocation, he would turn the arm outward, then push the elbow point back, then turn the palm of the hand towards the other shoulder, and thus the joint would bounce back in place. This is the same method that was approved by Swiss surgeon Kucher in the modern era. Evidence of all this many papyri found in different museums. First, the Ebers Papyrus, the most complete papyrus on ancient Egyptian medicine. It is the oldest papyrus on medicine, dating back to 1545 BC. It was found here in Luxor in 1962 AD and was acquired by Edwin Smith who then sold it to George Ebers. It is in 20 meters long and is in hieratic script, and is currently in the library of Leipzig University in Germany. Then, the Edwin Smith Papyrus, also found in 1962 AD, is believed to have been found in the same seal where the Ebers Papyrus was found. The papyrus dates back to 1600 BC, but recent studies indicate that it is a copy of an older one dating back between 2500 and 1000 BC. The importance of knowing the original history of the papyrus lies in the fact that it informs us about the historical development of medicine throughout the ages. It is currently housed in the New York Academy of Medicine. After then, the Kahun Papyrus, the first of which deals with the treatment of women's diseases. It is in hieratic script and is 22 and 5 meters long and is located in the University of London Library. The second specializes in veterinary medicine and contains treatment for birds and fish. It is in hieroglyphic script and is located in British Museum. Finally, we still have many interesting topics about the ancient Egyptians.